Hello, my name is Dr. Dewan S. Raja. Today I will discuss about microcephaly. Microcephaly means small head. So the head circumference is smaller than normal because the brain has not developed properly or has stopped growing. Head circumference is 2 to 3 standard deviation below the mean for age. This is often associated with intellectual disability. At birth, the head circumference is little bigger than that of the chest circumference. So, once the baby is born, we can easily assess the microcephalic baby because head circumference of the newborn should be more than that of the chest circumference. Often associated with intellectual disability, microcephaly may present at birth or develop within a few years after birth. So this is a microcephalic baby. You're seeing that head circumference is less than normal, but the face development is almost normal, but the head circumference is less than normal circumference of the mean age. What are the causes of microcephaly? There are many causes. We'll go through the major causes, and we have to know that microcephaly may be associated with other anomalies. Fetal alcohol syndrome. So if the mom take alcohol during pregnancy, specifically during the first trimester of pregnancy, the baby will suffer from fetal alcohol syndrome. And one of the features of fetal alcohol syndrome is microcephaly. Then again, abuse of cocaine by the mom that lead to microcephaly to the baby. Neuroanatomic abnormalities like cerebral degenesis due to any region and craniosynostosis. The brain induces the development of the neurocranium. If the brain does not develop, then the skull over the brain is not developed. This is an induction mechanism. So if there is cerebral degenesis due to any region, the skull bone over the brain would not be properly developed, and there will be very quick closure of the fontan of the suture. We call it craniosynostosis. Premature closure of the suture joint between the skull bones. Microcephaly may happen due to gross malnutrition to the baby or the mom during pregnancy, obstruction of blood supply to the brain due to any region, specifically during intrauterine life due to some type of obstruction to the umbilical cord, there is some block somewhere. Also in the cerebral circulation to the carotid artery or the circle of Willis area. So for any region, obstruction of blood supply to the brain may lead to microcephaly. Maternal Zika virus infection. This is found in Brazil. Many women who suffer from Zika virus infection, their baby born with microcephaly. Most of them, not all, the pregnancy outcome. A significant number of the pregnancy end up with microcephalic babies. Fetal exposure to torch. Torch is the abbreviation for toxoplasmosis. This is a protozoal disease, usually come out of the feces of the cat. Okay, rubella or germal measles, cytomegalovirus, very common viral infection, and herpes simplex infection. Herpes simplex, if it is in the vaginal canal, it is wise to do C-section to prevent the herpes simplex infection to the baby. Okay, so this torch infection, all of them are associated with microcephaly, small circumference head of the newborn baby. Maternal HIV infection may lead to microcephaly to the baby. Venezuelan equine encephalitis virus may cause microcephaly in a number of cases. Okay, so if you look at that, there is some chromosomal anomaly that was associated with microcephaly. Okay, like the cry-do-shed syndrome, cat-like cry, and chromosome P minus syndrome, coffin series syndrome. Okay, there will be defect in the fifth digit and the toenails, and also coarse faces. Okay, the coffin series syndrome, Down syndrome, there is trisomy 21, even trisomy 22 may be associated with microcephaly. Trisomy 13, Petu syndrome, Angelman syndrome, problem in the chromosome number 15, fetal hydantoin syndrome, mom has epilepsy, mom took hydantoin type of medication during pregnancy, that may lead to fetal hydantoin syndrome, and that may lead to microcephaly. High levels of ionizing radiation due to any region will lead to microcephaly in many cases. Warfarin toxicity, this is an anticoagulant. During pregnancy, it is contraindicated, but if someone take it, then baby will develop microcephaly due to fetal warfarin syndrome. Microcephaly may be transmitted through autosomal recessive inheritance. Okay, this is the baby with microcephaly. Face is almost normal. Okay, normal size face. Small neurocranium. Neurocranium is small. Okay, so usually the defect is associated with mental deficiency. Not only that, some baby might have even convulsion. And this defect may be associated with other defect like in the heart, especially in fetal alcohol syndrome. Will get heart problems, especially atrial septal defect, ventricular septal defect, that may happen in this case also. Okay, so here we are microcephaly. It is the incidence in the United States. Incidence means new cases. New cases of microcephaly, 1 in every 800 to 5,000 live births in the USA. Diagnosis during pregnancy by ultrasonography. Treatment, there is no specific treatment. We need routine checkup to monitor growth and development, and baby should go through speech, occupational and physical therapy. Best way to prevent the microcephaly. So no alcohol, no cocaine during pregnancy, and the offending drug, avoiding ionizing radiation. Okay, so those may be avoided to decrease the incidence or prevalence of the microcephaly. Okay, so that's all about the microcephaly, its causes, its diagnosis, incidence. Treatment, there is no treatment, but supportive treatment may be required. If the child has convulsion, we give anticonvulsive therapy, need physical therapy, yes, speech therapy, occupational therapy may be required. Okay, so please support my channel, please subscribe me, and please share the information with your friends. If you have any question, please feel free to ask me. Have a nice, wonderful, and blessed day. Bye now.